No more medicine for the masses.
This is not a one-size-fits-all disease.
Now, treatments designed with you in mind.
It's unbelievable. It really is. That it's just for you.
From cancer to heart attacks to vitamins, should everyone have a personalized prescription?
Due to the advanced testing, we're able to look at people on a cellular level.
Targeted therapy.
You know, I've always been interested in medicine and how the body works. I was lucky enough to work in the emergency room when I was like 14 years old, and I had two doctors take me under their wing and educate me. That was a blessing. I became a paramedic, and I really wanted to save lives. And what I realized that working those calls in the street, not only was it damaging me, but I wasn't really saving people. I was sort of prolonging death, as they say. Now with this program, catching people early, we're saving lives. Okay, that's what's exciting. I have a long history in this field, and I really feel that this is it. This is going to be the place, ground zero, that's really going to turn medicine around. We're currently working with a heart transplant patient, a brain injury patient, a college president, and a rock star. These people have come to us because they know what we can do at this facility.
You know, Russ, in the practice, you know, my experience has been, and I always talk to people about when they ask me, well, what do you see the most? And I said, well, you know, what we see the most is a lot of aches and pains in people that are depressed and down and anxious and thinking that they have a lot of, you know, issues in terms of cardiovascular disease, you know, diabetes. But when you really come down to it, a lot of problems really are psycho-spiritual or psycho-emotional problems that have to do with the effects of stress. And you know, as well as I do, that stress, unless we all have stress, and we all hear that word in our society every day, it's really how we manage our stress that really makes the difference. However, the management of the stress has to do with having a really healthy body and a really healthy metabolic system that can help you manage that stress. Having a healthy hypothalamus pituitary adrenal axis that actually deals with that stress reaction, and how we could balance those hormones that are produced under stress to get people to actually heal from all this stuff. So it is amazing to me that when I see people over years, yes, they do have some real physical illness. However, a lot of the physical illness is really caused by an imbalance, not only in how they manage stress, but it could be a nutritional imbalance. It could be an intestinal imbalance where they're not absorbing and eliminating properly, where they're not absorbing and digesting food properly. And we know that the gut becomes a huge second brain. It's a second brain, and it becomes our major immunological organ to fight infections and disease. So the effects of stress and dealing with all the people that you have dealt with, and the effect of stress in people and how they deal with stress in their everyday life, really becomes now a physical problem and not just a psychological problem. And the manifestations of stress on the body are just incredible, and what happens there.
That's exactly right. Doc mentioned the HPA axis, the hypothalamus pituitary adrenal axis. Whether you're an executive or somebody in the war zone, you have one foot on the gas and one foot on the accelerator, and your body is working overtime. And what that does is it lowers our two feel-good chemicals in our brain, serotonin and dopamine. Well, we have a PTSD program now where we actually work with troops that have come back. And a lot of them are medicated with Prozac and Xanax, which is okay to get them through the rough spot. But because of the testing Doc and I do here, is that we're able to look at different levels of the brain chemistry, their thyroid and their adrenal glands and their testosterone levels. All these things impact their brain chemistry. All these things are depression protocols to help people get out of the bad spot. And again, nobody's doing this the way we developed it here, and that's why it's exciting. And also the data that we're developing here on the testing, we'll be able to share with other physicians to implement in their practice.
One of the things that I've seen with the treatment of the PTSD and anxiety depression disorders is that people end up on these medications, these serotonin, SSRI, serotonin reuptake inhibitors, dopamine agonists, and so forth. And then what we see is that we constantly had to keep increasing the dose, and people really never truly got better, because what we should be doing with those drugs is when someone comes in at that level of stress or dysfunction, is to use those drugs as a bridge. It's only a bridge, but in the process of getting over the bridge, we're looking at what's underneath the bridge. We're looking at their metabolic processes, we're looking at their transmitters, and then we're embarking them on a lifestyle change, on a nutritional change, and on a metabolic optimization program that will get them, once they're over the bridge, to not have to depend on these drugs that we know, Russ, could actually be detrimental after long-term use.
Right, exactly. Yeah, and what we find that in women and men, right around 30, they start to lose progesterone, women, and testosterone. We know that both these medications bind to the same receptor sites in the brain as Prozac and Xanax. So when you're under any stress, you lower your hormone levels. So if you need the SSRIs, like Doc said, great. But then as your body starts to optimize itself and you come through our program, we're going to rehab you with progesterone, a natural antidepressant for women, testosterone in men, a natural antidepressant. These things are going to affect a person quickly and optimize their life, help them get back on the road to wellness. And that's one of the things that we offer here that I'm really excited about.
Yeah, Russ, I've had the privilege of sharing at least 10 patients that have been with your program. And every single one of them told me that they have not felt as good as they feel now for the last 20 years. That once they got on your program, and they actually got on the program that we have developed, and that we're going to continue to develop and optimize, that it's made a tremendous impact, not only in how they feel physically, but in their relationships, and how they relate to other people, in their work, in their business. To me, it was actually quite fascinating, because everybody had the same story, but it was their story.
Right, exactly.
Men, women, all ages so far. So you know, I'm really excited to work with you, because I know deep down in my heart that this is the right thing that we need to do for the people that we're going to serve.
Exactly.
And that to me is incredibly exciting, and it really is a blessing to be able to do that.